Good morning, friends. Sondra here. It is Tuesday morning, 10 a.m. And like I said, I wanted to go live to talk to you guys about this pain masterclass that I'm offering next Thursday night, June 29th at 5 p.m. Mountain Time. So that is 4 p.m. Pacific, 6 p.m. Central, and 7 p.m. Eastern. Back in December of, I think it was 2018, I all of a sudden had this severe pain in my neck and had radiating pain down my arms all the way to my fingertips. It felt like a burning nerve pain, and I ultimately had to go see a neurosurgeon to get some imaging done and get referral for physical therapy and some medication. But it was 3 weeks until I could get in to see our local neurosurgeon, who happens to be a colleague of mine, and I still couldn't get in any sooner. The only thing I had for pain at that time was Advil, which, just in case you're not aware, anti-inflammatories that are over the counter are really, really hard on your stomach, your gut lining, and so it's not a great long-term option for pain management. And I remember sitting in our living room one night, and my husband was like, "Did you not think that commercial was funny?" Because he was laughing hysterically at some commercial. And I said to him, I go, "Oh, I'm not watching TV. I'm just staring at the television and trying not to cry. I don't like to be a complainer. I don't find that complaining about pain helps me." And so I was just very internal. I was just trying to cope with what was going on. And it was at that time that all I had was Advil, and I had this excruciating pain. And oh, by the way, I work in a hospital, and I was still having to go to work and take care of other patients. I had to figure out some non-narcotic ways to manage my own pain so that I could live, so that I could go to work, so that I could make money. And it was at that time that I began to explore using guided meditation for pain. And the best way I can describe this is that, and there's a particular meditation teacher I love, so shout out to Andy Hobson on Insight Timer. You can find him on Instagram too. But I listened to this 45-minute pain meditation from Andy. And the way I describe it is like, I laid down on the ground, okay, so I was reducing the effects of gravity, right, on the compression of my spine. So when we lay flat, automatically that reduces the pull of gravity on your spine, so that was helpful. But I popped in my AirPods or my Bose headphones, I can't remember, and I listened to Andy, and this is how I describe, he coached me into the pain cave, okay? So prior to doing this guided meditation, I felt like my brain, this is what was happening in my brain. This hurts, this is never going to get better. What do? I'm hurting, I can't. It was just like this constant loop of just like, I hurt, I'm in pain. This is never, ever going to get better. And what I felt like the guided meditation did for me is it made me like confront my pain and realize that this couldn't kill me. And I tell this to my patients, pain cannot kill you. You can make a bad decision because of pain. And that pain could be emotional in nature, physical in nature. But newsflash, all pain is both. So I felt like Andy coached me into the pain cave, where I came face to face with my pain, and he just guided me through breathing, right, which calmed my nervous system. And then my pain, it's like the volume on my pain started to go down, okay? It didn't make it zero. I'm not gonna blow smoke, but it went, let's say, I think it was like a 7 or 8 down to like a 3 or 4, which I don't know about you guys, but like a 3 or 4 on a 0 to 10 pain scale is way more tolerable for me and most humans than a 7 or 8. And so what I found was that if I laid on the ground, if I put a hot pack on the back of my neck so my muscles would relax, I put on a guided meditation. I did take my Advil, right, until I could get into the neurosurgeon and get an MRI, start going to PT. And then I got a script for a tapering dose of oral steroids, which happened to be very good for bulging or any disc issues, essentially. So just know that if you have a herniated or bulging disc, that is symptomatic, okay? You can have these things in your body and not have any pain. You can also not have anything anatomically wrong with you and have this pain. And that is where I just started to realize that I have some control over my experience of pain. I didn't have any narcotics. I didn't have that steroid pack. I didn't go to PT immediately. And I realized after I did that 45-minute guided meditation, like, wow, I didn't physically do anything to myself. And my pain decreased from listening to another human coach me through my pain experience. And then it was at that time that I was like, there's really something here. Like, I want to learn more about how to help my patients not only manage their pain, but change the way they experience pain so that I could get better outcomes with my patients in the hospital. For those of you that may be new to me or watching this for the first time and you don't know anything about me, I'm an occupational therapist. I've been in OT for 16 years. OT is similar to PT. We focus more on kind of your daily occupations. Has nothing to do with your job. So occupations meaning anything you do that occupies your time. So I like to think of what I do as helping people get back to life after injury, illness, trauma, accident, anything like that. The hospital I work in, we primarily see orthopedic trauma. We tend to cater to a lot of tourists who are in Colorado for ski vacations or summer camping, mountain biking. We see a lot of concussions, tons of broken legs, broken arms, broken ribs, spine injuries, all sorts of orthopedic traumatic injuries. And a big barrier to our patients working with us in therapy and then getting to get out of the hospital and go home back to wherever they're from is pain and their fear of being in pain. And it is my job to address that so that I can help them get up and get moving and get back to life, because that's how you get well after anything, right? In the therapy world, one of my PT colleagues says, and I love this, motion is lotion. A lot of times when we're hurting, we think, oh, I'm going to go lay down or I'm going to go sit down because I'm hurting. And a lot of times when we sit and we're in a static position, our pain actually gets worse. And because we're not often doing anything when we're sitting or laying, our brain will hyper-focus on wherever we're experiencing pain. And that is why distraction is such a great tool for pain. In silence when you're not in therapy, because all you're going to do is focus on your pain and it will get worse. I want the TV on or a crossword puzzle or listening to music, talking with family or friends, anything that engages your mind, that distracts you from that tendency for our brain to want to hyper focus on pain. But ultimately, after all this, my personal experience, and then just realizing the power of the mind, I decided to attend a continuing education course called Psychological Approaches to Managing Pain. And it was taught by a woman named Beth Darnell, who is an associate professor at Stanford University. And it was an incredible course. It was through the Institute for Brain Potential. And this is really where I solidified a lot of my knowledge, my clinical knowledge and personal experience with the science and evidence to back it up. So I created a course called Alternative Approaches to Pain Management that I taught at the hospital that I work at. And I just wanted to share this little story that before I started teaching this class, which was just like a lunch and learn, so it was kind of a quick, down and dirty 45 minutes. It was not super long or in-depth, but I asked a room full of my colleagues, which included therapists, PTs, OTs, speech therapists, doctors, nurses, techs, patient care techs. I asked them, a room full of, I guess, 40, 50 people maybe, healthcare professionals, who in this room, and I asked everyone if they wanted to close their eyes, they could, so that they, felt comfortable sharing. Who in this room feels like they are good at relaxing without the use of a substance, whether that's legal or not? Okay, so that could be anything from alcohol, right? Have that glass of wine after work, that beer after work. It could be a prescription for like an anti-anxiety medication. It could be cannabis. We're here in Colorado. That's legal. I didn't want to know the details because what people do in their free time is their business. But in a room full of 40 to 50 healthcare professionals, one person raised their hand to say that they felt like they were good at relaxing without the use of a substance. And I said, you guys, this is a problem because we're the ones that are supposed to be teaching our patients how to relax without using alcohol and drugs and more medications, right? Because at some point, all of our patients are maxed out on the amount of narcotics that we can give them without it like truly being a risk to their, depressing their central nervous system to the point that we worry about like their breathing, okay, for lack of a better way of explaining it. So my motivation to learn more about this was, twofold. One, how can I help my patients so that I can get better outcomes in the hospital that I work in? And two, how can I educate more humans about this mind-body connection so that more people feel empowered to do things when they experience pain other than just go to the doctor and get narcotics, which are highly addictive and kill so many people in this country. I'm sure many of you watching this may know someone who has struggled with an opioid addiction. And so I really want to offer this masterclass on non-narcotic pain management so that whoever sees this and is struggling with chronic pain, or even if it's an acute pain, I want to give you tools, because you will have those tools with you for the rest of your life. And you can then tell your mom or your friend or your spouse or your patient about some of these things. Stop just giving pills and more pills and making people dependent on medications, only medications. Now, don't get me wrong, narcotics have a place, okay? Most of the patients that I see after severe orthopedic trauma would not be able to work with me if they did not have some sort of pain medication on board. However, my goal is that I don't want them to feel like that is their only tool to deal with pain, and I don't want them to be afraid to wean off the pain meds and use other tools to help cope with pain, because their pain will fluctuate as we heal, right? Especially from an acute injury. Your nerves, after you have surgery and you get cut open, which is a second trauma if you have an accident, everything is angry. All the soft tissue, your nerves, they're pissed off because someone went in and messed with your body, right? And so we have to learn how to calm ourself, our nervous system, our brain, so that our body can do what it's meant to do, which is to heal, okay? And not to stay stuck in that stress response of fight, flight, fawn, or freeze. So this masterclass will be an hour and a half. I'm happy to stay longer for optional Q&A, or if people are struggling with something individually that you want to ask more questions on, I'll be there. This is next Thursday, June 29th from 5 to 6:30 p.m. Mountain Time. And right now it's early bird pricing for $33. You guys, this is a third of the cost that I paid for myself to go to this one class to get all of this knowledge. So you guys are getting kind of the meat and potatoes of 16 years of clinical experience, the research and evidence behind a lot of the techniques that I'll teach about and share with you about. The cost that I've made this class for $33 is a third of the price I paid to attend this continuing education class. So this is a really good deal, and that's on purpose because I want this information out there to as many people as possible. I'm not sure why this is not talked about in every healthcare setting by every healthcare provider. I can't change our system. I'm one person, but I can fill in the gaps. I can provide the missing education because I work for me and I have the time to create these things and offer it to the public and support people in a way that doctors don't have time to. Even the best doctors in the world, the way our system is set up is they don't have time. They will not get paid if they don't see a certain number of patients a day to meet their productivity requirements. It sucks. I hear you. I am on the receiving end of that kind of rushed care myself, and I hate it. And so this is the way that I feel I can help kind of bridge that gap between what's happening in the real world in Western medicine and what people actually need to help themselves get better and heal. My ultimate goal for anyone who attends this course or this masterclass is to suffer less and live more. I know that health, the foundation of our health is our ability to engage in meaningful activity, meaningful occupations. That's why I do what I do as an occupational therapist. But if we have so much pain that we can't do the things we love, and then we get depressed, and depression causes more pain, and when we're depressed, we get more opioids. You're 8 times more likely to be on a high dose of opioids and stay on them longer than other people if you have a history of depression, which, by the way, is me. So this is something near and dear to my heart. As I've mentioned in other videos, I actually also struggle with chronic pain because I have hypermobility. My joints are super loose. I have really loose and lax ligaments. I'm sure that was from years of competitive gymnastics, perhaps a hereditary disposition to being more hypermobile. But I had an orthopedic doctor at 8 years old who referred to me as Gumby. So I don't know how many 8-year-olds are out there that have orthopedic doctors, number one, but who have a nickname for them because they're so loosey-goosey. So I have pain. As I'm aging, I have more and more pain from loose ligaments and hypermobile joints that move around too much. And so this is something I have to work at constantly myself. And I feel like that is what makes me the best person to teach this, because when patients say to me, "You don't understand," I can say, yes, I do, because I have had some of these issues. I have chronic pain. So I know how valuable it is to actually have tools and practices that support your ability to regulate your nervous system, which automatically will impact your pain and how much pain you experience and the intensity of the pain. So if you are someone who struggles with chronic pain, or you have an acute injury and you're struggling with it, or perhaps you've been through some trauma in your life that has had lasting effects and you have somatic issues in the body, you experience pain in your body from some trauma you've experienced earlier in your life, this course, this masterclass is for you, okay? There is no such thing as physical pain or emotional pain. It is always both. And if you come to this class, I will convince you why. I will give you resources to empower you to continue learning beyond this masterclass. $33, Thursday, June 29th. I will put, the link will be in my bio. Everyone is invited. If you feel like this would benefit you or someone you know, please tag them in the comments, because teaching this information is fun for me, but it's only impactful if I can actually help people. So I need the people to come. So please, anybody you know who struggles with chronic pain, your mom, your best friend, your child, your spouse, tag them, tell them about this. I want to help. I want to offer this information. I want more people to feel empowered to use the power of their mind to control the way they experience not only their pain and their body, but even the world. When we learn how to use our mind to change the way we experience things, you're unstoppable, okay? And if we're not addressing the psychological components of pain, we're missing the boat. We are totally missing the boat. Pain is a sensory and emotional experience. It is not just one or the other. So this whole, like, if you're having physical pain, you go to the doctor, or emotional pain, you go to a therapist. It should always be both. We should always be trying to treat both components of pain. Okay, there's never one without the other. Anyway, I'm done talking. Thank you for letting me share this story. I hope some of you guys will be there. I'm going to also upload this video to my YouTube channel, as well as make one for my TikTok. So wherever you are active on social media, please reach out, tag people, let them know about this class. I want to help, but I need your help to get to the people that need this information the most. Okay, I think I'm done. That was a really long live. 22 minutes. All right, you guys, have an amazing Tuesday, and hopefully I will see some of you next week. Please just message me if you have any questions, and that's it.